Good afternoon, everyone, and welcome to the EPA's first ever online membership webinar. My name is Julian Beezhold. I'm the Secretary General of the European Psychiatric Association, and I will be moderating the discussion. We've got three members of the Executive Committee with me, and they will first answer some questions to myself, and then we will encourage you to submit questions yourself at the end, and I'll explain how to do that in a few minutes. So the three people we have with us are Professor Andrea Fiorillo, who's the current president of the European Association. We have Professor Martina Rojnic Kuzman, who's the current treasurer of the association, and Professor Umberto Volpe, who is the current secretary for sections, and they're all with me on the executive committee. Now, the idea of the webinar is to give you as members, or perhaps people who are considering membership, an opportunity to hear a little bit from us about our experiences, something about the membership, and something about how we got involvement, but a little bit of an informal and personal take on all of this. So I'm going to start with our president, Andrea, and perhaps kick off, Andrea. You've been involved with the EPA for a number of years now. Can you share with us a brief, maybe reflection on how you've seen the association change since you've been involved, and also what this has meant to you personally?
Thank you, Julian. Your question, is very important for me because I think that I've been involved with the association since I was a kid. Started my activities before I was an early career psychiatrist, joining EPA since the Stockholm Congress, first as an observer, then as a trainee, and then as a participant. And since then, I have seen many activities going on, many changes in the association, but also in my personal life. What I can tell you all is that the EPA meant a lot to me. It has been more like a family or a group of friends, and I'm pleased to see that many of those people who I started with are still involved in the EPA, but also those members who were at that time leading the association, the Secretary General, all the past presidents and so on, are still very much involved in the EPA. Compared to other associations, EPA has always been an association mainly made by clinicians. So this is, I think, the backbone of the association is the individual role of all members. And I think this is basically one of the most strength of this association, also compared to others. But times change, and as time change, we also have changed our association. So now we have, since a few years, the Council of National Psychiatric Association. We have many sections very active in the different fields of the association. So I think that also the growth in terms of numbers, in terms also of staff members, and also of individual members, actually witnesses these changes. From a personal viewpoint, I can tell that all the speakers of this webinar, and particularly our chairperson, are very close friends of mine, and particularly happy to join also these activities these years and my presidency with all of them. And this is what I was referring to when I said a group of friends. I started my activities in EPA as the chair of early career psychiatrist, and then board member, and then secretary for sections, editor of the journal, treasurer. So becoming now the president for me means a lot in terms of belonging to the association, knowing all the different aspects of the association. And I think that this is something that we shouldn't lose also for the future.
And Andrea, how do you see the main mission of the EPA today?
Well, I believe that today the main mission is to try to balance at least three different aspects of mental health practice. One is clinical activities, so we should try to improve as much as possible our clinical activities in order to have them more aligned in the different countries. One is education and research, so we should invest, as we already do, in educating not only medical students, trainees, and early career psychiatrists, but I would say all mental health professionals and allied professionals on the field of mental health. And third is the advocacy and the policy level, because I think that we should let the others hear our voice very loudly. So in this sense, we all work very hard in order to get to be more involved in the educational level and European level. We know that we have a very active and strong committee on education with several activities going on during the Congress, but also beyond, with taking advantage from online courses, but also in person and summer school and other activities. This is something that our colleague Cecilia Non is coordinating since a few years now. But I would say also in a political and a policy level, in collaboration with the Association of Users of Gamian Europe and family members, UFAMI, we've been at least in the last year twice at the European Parliament to discuss about mental health and about brain health and about also the role of our patients. And also very important for me is let's say research activities. In this sense, now we have a very strong group working on the research. We are participating in several European funding projects spanning from different areas. Last year, we have had about 15 proposals to participate in the European grants. So this is something I think also very important, which gives the idea of what we are doing now also for research. We have expanded our horizon in terms of collaboration with other associations, so particularly European Academy of Neurology. We have a memorandum of understanding with ECMP, with the European Federation of Psychological Associations, but I would say many others, so I don't want to forget anyone. I think that the art of mission today is, I would just say, to improve care and to expand horizons for better mental health care.
Thanks, Andrea. And also, just thinking about your role as president of the EPA, what are your top three priorities?
Well, I mean, apart from these that are, let's say, general framework of my plan of my presidency, if you don't mind, I would tell you 6 priorities, not 3. One is to improve care, as I was saying, so with the focus on innovation, on digital mental health. We know that in Europe there are many countries where digital psychiatry is not at all adopted, so this is something that we should consider, but also to try to move our activities toward other settings of care, such as the workplace or the school. So this is one area. Another one is brain health. Brain health means not neurological disorders, but brain health means having a better insight on what are the genetic and biological and social determinants of health, of brain health, of mental health from the lifespan, so across the lifespan, so from the beginning until the very end of life. So this is another key area. The third one is precision psychiatry. So I think that we should refine our diagnostic approach and also to try to tailor the therapeutic opportunities we do have in mental health. Not forgetting that our treatments are among the most effective we do have in the whole medicine, but there is a problem between efficacy and effectiveness of our current treatment. A fourth area is whole person health, or I would say the physical health and mental health. So this is an area that I think as Italian is really important, because behind the illness and behind the disorder, we should also always consider that there is a person, and that we should consider the person from the beginning of his or her life, including lifestyle behaviors and social network and social connectedness and so on and so forth. A fifth area, extremely important, public mental health. We need to have scalable approaches in mental health, so not just something that we should do as community treatment. This is important, but of course we should try to find a way to better harmonize treatment. And sixth, I think that we should nowadays be very careful about vulnerable groups. Vulnerable groups are those at high risk of developing mental health problems, and in this sense, as vulnerable groups, I would say migrants, refugees, displaced persons, but also women and children and the elderly, but also people from the LGBTQ plus group. So this is the 6 task forces that are part of my presidential plan. All 6 activities are now fully in operation, are working very hard to try to implement better mental health care throughout Europe.
Thanks very much, Andrea. And just to welcome those who've joined since we started, and to remind people to think of questions that they want to ask at the end. So we'll hear from the different speakers first. The next person I want to ask a few questions is the Treasurer of the EPA, who's Professor Martina Rojnic Kuzman. Martina, how has your EPA involvement impacted on your professional development?
Hello to everyone. And yeah, I would probably say, in a similar tone as Andrea, I think the EPA has impacted me greatly. And I would say that actually it really helped me developing from a kind of biological-oriented psychiatric trainee that I was when I came into the EPA in 2013 or something, now closer to the definition of the competent psychiatrist, if we want to share of follow the UMS criteria to be a clinician, academic, scholar, collaborator, health advocate, mental health promoter, leader, and anything else which was actually meant by the document. And I would say that all these roles I learned through the experience in the EPA, but maybe some of the periods of the EPA activities or projects have a greater impact than the others. And if I have to have pointed out on 3 projects or 3 periods, I would start probably with the first one during my by being in the early career psychiatrist committee in 2013 or so, which was composed of 5 members, but also there was a network of early career psychiatrists. And together at that point, we applied and won a European grant by the Agency of Mobility for EU health programs in several countries. And that we developed a mobile phone application for the monitoring of medication side effect. We tested in several centers, and we also had the opportunity to bring 50 early career psychiatrists who were involved in the project to come to the EPA Congress. And this project was, one of the ones which left you with some feeling of enthusiasm and just wanting to be more part of this community. And then in the later states, I was working as a board member. And I had more developed kind of interest in the organization of psychiatric services. And I was involved in Croatia in a project called Recovery, which was a project which was run in several countries. And the idea of the project was to implement community mental health teams in several countries where these do not exist, based on a model from Netherlands. And the EPA was also one of the partners of this recovery project. And this project, I had really could see what was the good thing from the EPA, because through my experience in the European context, all my knowledge and experience really helped me in my role as a national coordinator, finding good ways to effectively implement these services in Croatia. So it really, I could, feel what was an income or something good, which really came from the EPA. And then third, I would say that probably one of the also very intensive learning times in the EPA was the COVID pandemics and the war in Ukraine that started. And at that time, I was one of the members of the EPA Executive Committee, which was composed of 8 people. And at that time, I really understood like the reality and the depth of the leadership, which was linked to difficult choices, taking responsibility for the choices and for the association that we at that time represent, and also to lead some actions. And it was at that time only a member of the committee and only have a limited role. But what was some learning experience for me was that actually I was surrounded and I had the luck of being surrounded with people who were giving great support and were great leaders present at the time, including at that time was Professor Gordon and Professor Farka, but also you all the members from the committee. And this really influenced me. So to return to the first question, EPA really shaped my professional identity and also personal identity, and also I feel kind of being among family.
Thanks, Martina. You mentioned that you're from Croatia. Can you share a reflection on how this has impacted on your path through the association and through into leadership positions?
This is also something which was also very, I would say, important for me as well. And maybe again, starting from an early age in different directions. In the early age, so as early career psychiatrist, I thought it was as a kind of disadvantage because there was no feeling just coming from a Southeastern European country. When you compared your knowledge and experience, the psychiatric needs with those coming from the Western European countries, just by coming from there, you thought that your valued your experience and knowledge as a trainee is not as good as there. It was just it was a feeling. I don't know whether this is still the case, but 20 years ago for sure it was. And it led to kind of reluctance in speaking up or taking some position because of this feeling. And of course, there are many reasons for that. They are related to culture and history and so on. But nevertheless, or even disregarding all the reasons, the feeling was really true and it had a real impact. And therefore, in this early age, I really had to learn to overcome this feeling. And I did it through the work on the EPA, specifically at that time, the work on the ECPC, actually with you, Andrea, and Umberto and Cecile and in other people in different times, all coming from the Western countries. And with the interaction with you, I learned that this kind of where I was coming from is not so important, but rather is important to what you can contribute now. And this is something which was, maybe it seemed trivial, but for me, it was like a mind-changing, opening opportunity. I don't know how to put it differently. And afterwards, in my later years, I actually learned that coming from this country could be an advantage, because it allows me to understand the need of having this regional context when you formulate any kind of European view, and to see that these different contexts are rather an advantage and opportunity than anything else. And for instance, in the last years, I've been leading the Ambassador project, which aims to gather field information by clinical psychiatrists across Europe on different topics by using surveys. And then we collect these surveys from psychiatrists from more than 30 countries, which are members of the EPA. And we try to formulate a shared view by the European psychiatrists, but taking account the regional differences. And what we learned is, for instance, that the organization of care during the pandemics across Europe was very different, that the clinical decision-making across Europe is very different, that even disorders are treated differently. For instance, PTSD is treated with different psychopharmacological treatment in Northern Europe than in Southern Europe and then in Western Europe. EMDR is used mostly in Northern Europe, but not in Southern Europe and in Western Europe. And so these are all these differences in the system, but we also know that there is no one perfect system and which has solved all the problems. And so we are still in search for the best models. And I think that one of the ways to do it is actually to inquire about the differences, learn from each other, and then exchange practices. And being from that background, I think even allows me to have this kind of view and pursue this as kind of a goal.
Thanks, Martina. Now, I know that before you were involved in the EPA, you were also involved with the European Federation of Psychiatric Trainees. So you've had the experience as a trainee and then as an early career psychiatrist. What advice do you have for early career psychiatrists who want to get more involved?
I think that the EPA really offers plenty of possibilities for early career psychiatrists. but depending, on the interest. So if you're talking about education, the EPA, for instance, the EPA congresses, they attract more than 50% of participants who are early career psychiatrists. So I think clearly that the content which we provide during the congress is something which is perceived meaningful to the early career psychiatrists. Then there's opportunities to get funds to it, like to attend Congress. Then there is reduced fees for early career psychiatrists, there are research prices. Then in between congresses, there are different possibilities, such as summer schools, which was guided by the Committee of Education by Cecile. Then there are webinars, there are MOOC courses, also free for all the members. And then there is another activity, such as European board exam, which is also of interest to many of the early career psychiatrists. And there is also the exchange programs, such as EPA Gaining Experience programs. And if they want to engage more actively, there is a possibility to do it through the early career psychiatrist committee, such as we did, and then they attend different surveys, research, publish together, and they can become part of this network and the community of the EPA, which is so vivid. And finally, there are, of course, other bodies like sections where members can gather of different age, different career groups, but based on their clinical interests, such sections for psychopharmacology, schizophrenia, and so on. So basically, I think that there are really many, many opportunities for anyone who wants to join.
Great, thanks very much, Martina. I'm now going to, just before we move to the last person to answer questions, just remind everyone there'll be a chance to ask questions at the end, which you'll be able to do by using the React button on your screen at the bottom to raise your hand, and then we will call you forward, as it were, to ask the question. So the last speaker is the Secretary for Sections of the European Psychiatric Association, Professor Umberto Volpe. So Umberto, thanks very much. Tell us about the EPA sections. What is the main function of the sections?
Hello, everyone. Thanks, Julian, for the nice introduction. Well, the EPA sections serve as specialized groups that tend to focus on specific areas of our discipline, ranging from child and adolescent psychiatry to old age psychiatry, from psychotherapy to psychopharmacology, and so forth. Of course, their mission is first to explore and solve problems within that specific area, that specific domain of psychiatry. But in a larger sense, they also tend to collect and disseminate information through educational and scientific events within the European Congress of Psychiatry or outside of it, always under the EPA auspices. Of course, one of the main characteristics of the section is to promote and foster collaboration, networking, possibilities for participants by building working relationships among professionals and also with other national and international bodies. The greater function, the greater scope, so to say, of section is to promote coordination across Europe in clinical, scientific, and educational domain. Let me point out, finally, that the 24 sections we have are, they tend to function independently from EPA. I mean that EPA provides administrative support, a general framework, but for what concerns leadership structure, membership recruitment, communication, and organizing activities, they are autonomous.
And Umberto, how do they support the professional development of members or for members?
Yeah, this is something that I can witness myself because I've been an officer in many sections. Usually scientific sections support member professional growth in many different impactful ways. One, of course, as I anticipated before, is to organize sessions within and courses within the European Congress of Psychiatry. But besides that, they also, the most active ones, tend to regularly produce also scholarly outputs in terms of publication, systematic reviews, guideline papers that both inform practice and tend to foster academic growth. Of course, also peer networking collaboration is another characteristic that tend to support members in each section. Usually there are specific mailing lists, WhatsApp groups, and meetings are held throughout the years, both virtual during the Congress usually and in person. So members through these may connect, exchange their ideas, and develop eventually collaborative projects. Let me point out finally that this is particularly relevant for early career psychiatrists because, I'm sorry, not only sections are involved in the gaining experience program of EPA, so they managed to host young members of our association in some selected and qualified units. But also they, at least in most of the sections, specific positions are usually kept for junior officers. At least this is what we do in the section that I have the privilege to chair, the digital psychiatric sections. But I'm aware that in many other sections there is the same attitude of encouraging younger members to participate actively in the section's life.
Thanks, Umberto. And maybe just as a last thing, can you tell us about a recent project from one of the sections that had a significant scientific or clinical impact?
Yes, I'll try to do this quickly, but let me mention at least 3 different projects from sections. For example, historically, the Epidemiology and Social Psychiatry section, they do organize an annual congress outside the EPA Congress. Last one was the 21st in a row, was held in Lausanne, Switzerland. Another initiative that I think have an impact, on a clinical impact, is the one that we as the digital psychiatry section had immediately after the COVID-19 pandemic. In collaboration with the Committee on Education, we released a video toolkit to allow all clinicians to get updated in order to achieve a good quality telepsychiatry practice. And this was done in a few months with the collaboration of Cecilia Non in the Committee on Education. The last example is a more recent one. Psychotherapy section has been one of the most active lately, and along the past year, they not only published the systematic review on psychotherapy training in European psychiatry, they have had a lot of contributions at the last EPA Congress in Madrid, but they also organize, in collaboration with the European Federation of Psychiatric Trainees, Balin groups. This was launched online, of course, monthly, and there was a very good chance to establish a new activity within EPA, and this was launched by a section.
Thanks very much, Umberto. So thank you very much to Andrea, Martina, and Umberto. People who are familiar with organizational meetings will know that it's completely unacceptable to finish early, but nonetheless, we have managed to do this. So thanks very much for giving such concise answers. That means there's plenty of time for questions. If you'd like to ask a question, please use the raise your hand button, which you can find in the React button at the bottom of your screen. If you raise your hand, then we will call you forward to ask the question. So I'll just give people a chance to do that. I can also tell you it's the first time we've tried doing this live, so I'm not quite sure what will happen next, but I'm hoping I will see a hand come up with the question. So we have, let's see. So first question is Dmitry, is it Satanovsky has a question? Please just go ahead, type your question.
Good evening, everybody. I'm Dr. Dmitry Satanovsky, neurologist and psychiatrist from Ukraine. Also a president of Ukrainian Association of Lifestyle Medicine. And after I heard Martina, I would like to know with who I can contact to be more involved in the organization of EPA.
So I will maybe just start off and suggest that the EPA website is a good resource to look at in the first instance. So that's Europsy, EUROPSY.net. But Martina, I think you were going to say something.
Well, the question is a contact, so I think it's the web page you said, and also I would say that there are contacts of the EPA offices, and if it's a question related to the early career psychiatrist, I would say then to direct to the early career psychiatrist committee also directly, and I'm very happy that there is an interest to join the EPA. Yeah, and also I see that there is a register to our Minds Online.
And if I may also, if you are evaluating becoming a member of EPA, you can also join sections. So you may choose the different specific aspects of our discipline that may interest you the most.
He's
Thanks
already a
very much.
member of the association, so the question is becoming more difficult, Martina.
Okay, to which, and maybe more specific question, to which activity would you like to be more involved in, so that we will be more specific on the response?
Thank you for the microphone. I think maybe in educational team or research team. I think something to discuss. Maybe we can find some interesting points that can be useful.
Okay, can we have, I saw that we have Cecile here. She is the chair of the Committee of Education. Can we also have her responding to the question of education?
When Martina doesn't know the answer, she
No, this is
go to someone else.
And even to someone who is not invited as a speaker.
You are the Committee of Education chair.
So love to. It's great pleasure to introduce Cecile Hernot, who is the Secretary for Education on the Executive Committee, and just recently the recipient of the Légion d'honneur in France for her work in psychiatry. Well done, Cecile. So you're in a great position to answer the question.
It's actually, I was not supposed to say a word to this webinar, but I'm very welcome to answer. All the EPA, all the activities, educational activities that EPA offers is absolutely great, and you cannot find something else anywhere else. The e-learning platform, especially when you can log in, and the fact of being a member offers you the possibility to have access freely at any time, anywhere in the world, to this e-learning platform with lots of content and online content about education, and it will just continue growing and growing. And you have other educational events accessible if you are an EPA member, such as the summer school and the CME courses, and of course some grant to access to attend the Congress with a low price. But I don't know if I have answers all the questions. I didn't prepare anything, but hopefully Natalia Grinko is there and she will ask another question and help me.
Okay, Julian, I will answer in my capacity of president. Dimitri, I would suggest you to attend our Congress where you will find a lot of activities. We have also some dedicated slots for Ukrainian colleagues. Actually, we launched a task force on physical health and comorbidities. We also have a section on that. So I think that you might find lots of interest in our association. But I think that the first aspect is to attend our conference. The next one will be in Prague, and start joining our either online educational activities, also the sections, as Umberto was mentioning. Martina only takes money because she's the treasurer, so don't speak to her. But all the others are good. Then it depends, of course, on your background. If you are in early career, if you are a professor, if you are a clinician, but I'm pretty sure you will find your appropriate way in the association. If you have this interest, I would say that this aligns very well with our activities.
Thanks very much, Andrea. So Umberto, should I just let you respond to that?
No, after the president has spoken, I mean, there's very little to add. Just the fact that, as Andrea correctly mentioned, given that this colleague from Ukraine was interested in lifestyle changes, there is a newly launched section on physical comorbidities. And I think that since he wanted to be involved both in research and in networking, I think that sections are a great way to start collaborating and eventually being more and more involved in other bodies of the organization.
Thanks very much. So Natalia Drinko, you've very patiently kept your hand up, and I'm hoping someone will switch your mic on so that we can hear you.
Minute. Okay, can you hear me now?
Yeah.
Oh, thank you so much. Hello, everyone. My name is Natalia Grinko. I am a medical practitioner from Ukraine. Actually, I'm a medical psychologist. I have a medical degree, and my specialty is medical psychologist. That will be my question. I'm your proud member since 2020, and I was listening you even General Assembly when I was in shelter. And I was listening to Peter Falkai, who expressed immense support to Ukraine. That's my gratitude to you and appreciation. I was telling all my Ukrainian colleagues, listen, EPA is supporting Ukraine in this terrible situation. So my question will be next, because I really like EPA and all its possibilities. I'm reading your journals for free, appreciate, because I'm from a not so huge country. And I'm applying for different scholarship because of the financial situation, all of that stuff. So there is an issue because I'm medical psychology, but I'm a doctor, medical degree, and I work inside of the mental health hospital. So some of your EPA summer schools, this will be my question or to your consideration, because I like medical establishment. I like patients and working with them. And I applied for summer schools about suicidology. And I would like to be inside of the mental health hospital to be there. And my application was declined because I'm not a psychiatrist. You see, yes, I'm not allowed to prescribe drugs. That's true. But still, I'm a medical practitioner. And I would like to attend this school. And I would like you to consider possibility to have permission for specialists like me with medical degree, but with different specialties. That's all I would like to do for us. Okay. And that's all. I don't know what to say more. Thank you for allowing to be there and to listen. Appreciate.
Thanks very much. Andrea, I don't know if you want to comment.
Yes, this is also for Cecile. Even if she was not involved, she has a lot of questions. By the way, you are totally right, Natalia. I don't think the issue is about who is a prescriber and who is not a prescriber. Actually, EPA is working with all those involved in mental health. So even clinical psychologists, but in your case, you are even different because you are a medical doctor with clinical psychologists. So I think that shouldn't be an issue about it. And I'm pretty sure that we should revise our rules of procedure. And I can tell you that together with Julian Beezhold, who is the Secretary General, and the next President, Celso Arango, we will work on the revision of the rules of procedure so that also psychologists and mental health nurses and someone else are eligible to attend our meetings.
Thanks very much. So the next person I think is Jaya Balakrishna. You've also very patiently kept your hand up, and I'm hoping someone will. There we go. Your mic should be live.
Yep, I think it is. Thank you, Julian. Hi, I'm adult psychiatrist working in the community with British forces. That's my day job. And Julian, you will know that I'm also active in our Royal College of Psychiatrists. I'm one of the associate registrars. So it's a question really because I'm conscious that the EPA provides a lot of resource and support for early career psychiatrists. And I imagine a number of us on the call are also middle career psychiatrists and beyond. But it's really a question about the extent to which the EPA has initiatives or projects or activities that relate to peer support, mentoring, and really providing space and time to look at psychiatrists and the jobs they do. If I can use a sort of buzz phrase, doing doable jobs, because this is something that exercises a lot of psychiatrists, certainly across the UK and a number of other countries, and I'm sure in Europe as well. But beyond the sort of scientific themes, which clearly are central to a lot of psychiatric associations, what efforts, endeavors does the EPA have in relation to that peer support, mentoring, and support for psychiatrists in doing their jobs? Over.
Thanks. I mean, that's a great question, which means I'm going to ask Andrea to respond.
It's so great that I haven't. I would pass to Martina now. Yeah,
Martina, you've drawn the short straw, really.
Yeah, I mean, yeah, it's a great question, and I think it's the question of how we can support ourselves in terms of everyday life. Yeah. Yes, I think that as we don't have, I think, an ongoing project, but if we look back at the activities that EPA has done, it has done, I think, it is an interest of the EPA. For instance, Julian Beezhold was one of the leaders of the burnout study among, psychiatrists, among the residency, which is still very much cited. And it was about the burnout of psychiatrists in 22 or something countries, where this burnout raises as very high. So this is very true. But it was more linked to early career psychiatrists. And also these initiatives are related to early career psychiatrists. In response to the adult psychiatrists, unfortunately, we don't have any kind of this initiative as far as I know, but it is a good, I think, idea to put it forward and to think about it. Because it's, and then I will now again bring it back to our president, who is having the task forces, 6 task forces for the mandate. And I think that could be part of several of the task forces, because as you rightly pointed, it is very important for us to take care of ourselves.
Well, thank you, Jay. Martina gave you the wrong answer, so I have to jump in. No, just joking. Actually, it is true that we don't have a specific focus on that, but I agree with you that it is extremely relevant. I can tell you that we have a leadership academy school, which has been organized this year for the first time. It was organized in September in Strasbourg. It was extremely successful, and it looked at networking, peer support, leadership, but also on burnout and how to protect ourselves and to balance between work and personal life. So this is one issue. A second one might be, I think, also extremely interested with Martina, maybe to organize one of the next ambassador surveys, because I think that there isn't a focus or a specific interest on these aspects on our mental health and well-being, either at university levels, but also in the national policies and within National Psychiatric Association. So this might be the focus of one of the next ambassador surveys. And I think, Martina, that we should consider Jaya when we prepare these ambassadors.
I would be very happy to help.
Thank you. I've seen Cecile at a certain point, maybe she wanted to talk about the Leadership Academy. I don't know.
So I'll just jump in quickly and say, Jaya, it's obviously a really important point that you've raised and something that we can and should work on. But like everything we do, it depends on people's availability and time and commitment and so on to do it. So we'd absolutely welcome your help, but also anyone else who wants to be involved and join in and assist with making
you remember
something
the
happen.
association, Jaya?
Well, you've given me a reason to join the EPA now.
Yes. So you should pay to Martin and then you can join us.
I fear there's going to be a premium on this.
No, it's good value for money. Cecile, were you wanting to jump in?
No, but about the Leadership Academy, Andrea, you wanted me to add some words. It's a new, it's a new educational event that the EPA has implemented, and as Andrea says about how to become a leader, which is quite of the an unmet needs, and I mean it's a gap in the education of psychiatrists. So it's indeed. It was a very lively event, very powerful in terms of education and training about how to speak up, how to manage change, how to impose yourself, how to become a leader, how to fight against burnout. So lots of topics has been addressed. And with several, and I think Natalia was attending, and for 30 youngest promising leader that became, you can say, become a member of EPA today and become a leader of European psychiatry tomorrow. Definitely.
Maybe this should not be restricted only to young psychiatrists, but also to middle-aged psychiatrists, as Jaya was saying, but also to retire. I mean, they can be leaders also if they're retired.
Of course, it's an ongoing process.
We should anticipate our future. Umberto.
Yes, I participated in the very early first study about burnout among psychiatric trainees. At the time, I was still a psychiatric trainee. The reason why often this issue is linked to the early career phases is because usually taking care of ourselves is something that is not taught formally. So it was good to have, for example, in the Leadership Academy, a module dedicated to that. I also think there are historical reasons for this, waxing and waning interest into burnout among psychiatrists. I think that also COVID pandemic has had an impact because at the time we were very concerned about our well-being, and then the pandemic went away, and we, just moved on other focuses, so to say. So I think it's a very timely observation. I'll be glad to participate in such an activity. Thank you, Jaya.
So we are going to shortly be cut off by superior powers who control these things. So I just want to say a huge thank you to everyone, to the panel members, and to especially the people who've joined the webinar as members of the audience for your participation. And just lastly to say, come and join us in the EPA, get involved, attend a meeting, speak to someone, share an email, share a contact, and you hopefully can be joining the future or creating the future of the organization yourself. So thank you very much all. Thank you also, especially to Carol, Guillaume, and to Simone Diona for their work in organizing this webinar. Thank you all and goodbye.